So thank you all for coming. I guess we'll go ahead and get started. We don't want to delay it too much. So welcome again to the LifeU class. This one is not if, but when, disaster first aid. So the last couple of classes we've been talking about like home preparations, emergency situations, things like that. Today we're going to be focusing more on the medical portion of it. And this class is brought to you in conjunction with Acts of Mercy. And Acts of Mercy is the kind of the disaster arm of the Antioch churches. And its single vision statement is to mobilize the church to engage, train, and prepare in order to offer practical help in times of disaster and to bring sustainable transformation to communities locally and around the world. And I'm so glad you guys joined us because that's one of the key words that they talked about is to prepare. And as you could see, disaster can occur at any time. We had, like a month ago, we had Snowmageddon in Texas. Just this week, devastating tornadoes in Alabama. I think there was 5 that perished because of that. So many people just, losing their homes and everything. And then, as you can even see, disasters are not just natural. Disasters are man-made too. We saw the horrific thing that happened in Colorado when the person went on a shooting rampage inside a supermarket. I mean, you're just shopping for food, and all of a sudden you get caught up in this whole thing. So we could see crises can happen anywhere, anytime. So as you are more prepared, you can help those who are not. And you can offer, really be Christ in the time of crisis. So we want to, again, thank you for coming to that. Again, today's topic will be focusing mainly on the medical. We'll be looking at topics such as opening up the airway, if it's closed off, controlling bleeding, treating for shock. I mean, these are all things that probably would have happened like at that Colorado shooting. Things that if you saw a person on the ground, you probably would need to render some of this kind of aid. So this is really timely. So we're going to be looking at that. And then I just want to let you know to, instead of breakout rooms today, we're going to have some live demonstrations that Albert will be providing. And then stay tuned because we'll have some more raffles as well too. We have a couple more prizes. We did it last time. So we'll have a couple more raffles. So stay tuned and stay engaged. So with that, I want to go ahead and turn it over to Albert. Albert is our very own Epicenter member. He's also a 26-year firefighter for both Ventura County and now presently LA County. So he brings a vast wealth of knowledge in this area. He's done a lot of CERT classes. If you don't know about CERT, we'll talk more about that either later today or in the future. But he has a lot of extensive knowledge in terms of preparedness and what to do. So Albert is with his sidekick, Pia, his wife. And so we welcome them again. So I'm going to turn it over to you, Albert.
All right. Well, good morning, everyone. I'm so excited to see that you guys are here on our 3rd class. Like Dennis said, the previous 2 classes dealt with being prepared either at home, the workplace, at school, or wherever you may be. So all those things are starting to build into what we're starting to incorporate for today. So this training and the next one is going to focus on medical disaster preparedness. So it could be happening in your home. Again, it could be happening while you're at the grocery store. You never know when an emergency comes. So these next things that we're going to cover today are some simple methods of how you can identify a situation that arises. You don't have to be a medical technician, an EMT, paramedic, or a doctor. Some of these techniques can be used by anyone and even younger people. So I just feel very blessed to be able to impart upon you some of these things that, again, it's always better to have this stuff and not need it. But in the event the situation arises, then we're hoping that this thing will bless you and be able to bless somebody else. So some of the guiding principles that we want to cover. I always state that whether I'm teaching CERT or I used to be a CPR instructor also for the department, is you want to make sure you're in a safe situation. That's first and foremost, your safety and that of those people that are with you. You may have people around you that are going to be able to help you and assist you, but you might be in a situation with yourself. You might be able to have equipment and tools that are available to you, but we're going to cover situations where you're going to have to improvise if you don't have those specific medical devices or tools, where you can use regular stuff at a moment's notice that will be able to make a difference in helping somebody survive a situation. So we want to do the greatest good for the greatest number of people. So some of the objectives we're going to cover. We identify what we call the 3 killers. Anytime there's an airway obstruction, any kind of uncontrolled bleeding, or a situation when an individual goes into shock. And then we're going to cover the techniques of how you can open and clear an obstructed airway, how we can incorporate techniques that we can control excessive bleeding, and what we can do when we encounter an individual going into a state of shock. So again, we talked about the 3 killers: airway obstruction, excessive bleeding, and shock. So anytime, even when we're in the emergency medical care service, when we're responding on a call, the priorities are we're going to make sure we have a patent and open airway, which that means is that somebody can get air in and out. Then we're going to address any kind of bleeding situation. Some of it may be internal. We don't know if there's an internal situation. The individual may be bleeding internally. But if we see any external bleeding, we're going to take measures to control that. And then the third one would be treating for a person going into a state of shock. Okay, so what I like to do, what works for me, is if we can get situations that we're covering, maybe some of this material is completely foreign to you, maybe not. But the way I try to make it, simplify it for people, and it's helped me and learn this kind of stuff myself, is by making little mnemonics or acronyms. So this patient care is simple as ABC. A being the airway, B being bleeding, and C being circulation of the blood perfusing throughout the body in the way it's supposed to. Okay, so if we do encounter a victim, again, like I mentioned, first and foremost is your safety. You want to make sure you're in a scene that you're safe. The individuals that may be assisting you are safe as well. So you don't want to become another victim. You're there to make the situation better. If the victim is conscious, you want to make sure they see you. You want to identify who you are. Hey, I'm Albert. I'm here to help you. Can I treat you? We live in Southern California, one of the most diversely cultural areas in all the world. So there's cultures where if you're a man and there's a female that is in need of assistance, if she's conscious, you can ask her permission. They may be semi-conscious or unconscious. If her husband is there or her father is there, good idea, good rule of thumb is to ask if you can assist. We don't want to make the situation worse, where a misinterpretation of trying to assist somebody, and then you have another individual, getting confrontational with you. So those are good rules of thumbs to how you can approach when you're trying to help somebody. Okay, so airway obstruction. You may or may not know that the tongue is the most common cause of an upper airway obstruction. As you see in the picture there, a normal person that's conscious and lying down will have the tongue and there's still an opening in the airway. In some instances, and it happens to people who have sleep apnea, when they go into deep sleep, that tongue occludes the airway. It will obstruct it. Or people that are subject to some kind of trauma, especially head trauma, when they're unconscious, the tongue itself will prevent air from going in and out. And it only takes 4 to 6 minutes for somebody to have brain damage, in most cases permanent brain damage, or even go into death because they are not receiving oxygen to the brain.
Want to share that story?
Sure.
So I have a quick story. I told Albert it might be interesting to interject 1 or 2 stories to kind of make it more real. So we have a friend who was at a restaurant, And out of the blue, she had a brain aneurysm. So she was eating, and then all of a sudden she just collapsed on the table. And if not for a nurse, there happened to be a nurse who was sitting in the table next door, right next to their table. He knew right away that she was probably not getting any oxygen to her brain. And so he went over and he resuscitated her. And meanwhile, they called 911. You can tell the rest of the story.
Yeah, it was actually in the Hollywood area at a restaurant, very famous, the Stinky Rose. And it really was the act of God involved in there. Cedars-Sinai is one of the premier hospitals in the country to treat individuals with that kind of an injury. LA City Station, not LA County, LA City Station 27 down the street. They responded within minutes. They got to the hospital. It's unheard of. Before 10 minutes from the occurrence, they were in the hospital and they were treating her. So it was really an act of the Lord there, but it just goes to show you that you don't know when a situation will occur. And in this case, Monica it's really a testimony of a miracle in itself, because she went through vigorous time recuperating and whatnot, but she's alive and well today through the grace of God.
Mm-hmm.
Okay, so how can we open up the airway when it comes to an obstruction by the tongue? We're always going to want to make sure that the individual, we may think they're unconscious, we're going to make sure that they really are unconscious. We're going to gently shake the victim on the shoulder, and we're going to ask, hey, are you awake? Are you awake? We also have to, before we do that, determine that that individual did not sustain any kind of head, neck, or spinal injury, because we don't want to make the situation better. But in this case, this scenario didn't happen. Somebody is unconscious. We're going to look. Here's my one of my props here besides my wife. We're going to look. If the individual, for example, is unconscious, we're going to look to see if we see a chest rise. We're going to listen to see if we can hear through our ears, if we're hearing air coming in and out, or we could also feel it. So we're going to look, listen, or feel. Then, if we don't hear a breath coming out or feel it, we're going to take the palms of our hands and on the forehead and do a gentle tilting of the head and the neck. So then we're going to look, listen, and feel to make sure that now there's air being exchanged. Simple technique just to open an obstructed airway because of the tongue. So we'll have a portion where we can demonstrate this at the end of this course today. So there's a situation where the individual may have sustained a suspected head, neck, or back injury. So there's a different method. It's called the jaw thrust maneuver. And it's better to use this method because it lessens the movement of the neck and the head. It basically is pushing the mandible forward by placing your fingers behind the jaw angle and lifting up. So we're going to have a video that's going to talk about how to do this. Are you guys able to hear? Okay, hold on. They're not.
You're not hearing it?
You guys haven't heard it yet, right? No.
Okay, try it again.
Sharing audio?
Yeah, I just want to make sure that the sound is being shared. All right, try it again.
Now? Okay, perfect.
The head tilt maneuver moves the neck and is thus contraindicated in a patient who might have a cervical spine injury. To do the head tilt chin lift, tilt the patient's head back by pushing down on the forehead, and then place the tips of your index and middle fingers under the chin and pull the mandible up. This lifts the tongue away from the posterior pharynx and improves airway patency. The jaw thrust maneuver does not cause much motion of the neck and thus is preferred over the head tilt chin lift maneuver if there's a possible cervical spine injury.
Can you all hear me?
Stand at the head of the stretcher and place your palms on the patient's temples and your fingers under the mandible. Next, lift the mandible upward with your fingers. This maneuver lifts the tongue along with the mandible, thus relieving upper airway obstruction.
Okay, so hopefully you guys all were able to see the audio besides the visual. So simple techniques that we just covered when there is an obstruction that's caused by the tongue. However, it may be an obstruction that's caused by a foreign object. So with regards to that, choking, it occurs when a foreign object becomes lodged within the airway. In adults, it's typically food, maybe not completely chewing something. And in young children, it's typically toys or objects that are around there. As you can see, this picture shows you an obstructed airway because of a foreign object there. Okay, so what are the signs of somebody going through some kind of a foreign airway obstruction? A universal sign is when you see people clenching their neck like this. You'll see that there's inability for them to talk. They're gonna show in signs of being in panic. It could be white eyes, maybe even tearing. They're gonna have either difficulty breathing or noisy breathing. They won't have an ability to cough forcefully. You'll see a change in color of their skin, especially their lips, and they eventually will lose consciousness. Okay, there's two kinds of airway obstructions. One that we call a mild airway obstruction. So in a mild airway obstruction, there's still an exchange of air. They can cough fairly forcefully. You can hear either gagging or wheezing, and they may still be able to speak. So what do you do if you see a situation where it's a mild airway obstruction? You want to encourage the patient to continue coughing. You don't want to interfere. It's common for people to start, doing some back blows. Don't do that unless you can determine that this is a severe airway obstruction. You want to remain with the patient, encourage them, but be by them. If you could be by their side, if it becomes severe and they lose consciousness, you're going to be able to assist them down rather than they go unconscious and possibly injure themselves more by falling to the ground. Now, on the opposite end of that is the severe airway obstruction. There's little to no air exchange, very weak and ineffective cough. They won't be able to speak. They're going to be clenching their necks. Remember the universal sign? They're going to have a very increased and pronounced difficulty being able to breathe. They are going to start to look blue, ashen, especially in the skin and in the lips. And they eventually will start to go unconscious and eventually maybe become fully unconscious. This happened to me when I was like 17 years old, working at a grocery store in Vaughn's. I was on my break in the back by myself. I was eating my lunch quickly because I needed to get back. And I had a complete airway obstruction. It was like completely panicked. Thank God I was able to cough that lodged food out. But literally, I was in the back of the store by myself. And only through the grace of God, I was able to dislodge that obstruction by myself. So if this happens, if you're not sure if it's a mild or a severe airway obstruction, don't hesitate, call 911. It doesn't matter if you call us and the situation gets taken care of. It's better that you get 911 rolling. And we've gone on many calls where we get there and we're no longer needed. Do we get upset about it? Of course not. The situation initially looked serious enough to warrant a 911 call. We want to make sure that the patient is actually choking. Ask them, and then what can we do? We can perform what's called the Heimlich maneuver. Okay, so what the Heimlich maneuver basically is you're gonna make your fist, and then you're gonna put it on the thumb side up. You're gonna locate your belly button, and in my case, here's my belly button. You're gonna roll it forward. So now you're in between your navel and what's called the xiphoid process. This little bone that if you feel in your chest, it's kind of soft and pliable. You're gonna grasp your other hand and you're gonna make strong inward and upward thrusts. And you're gonna continue those thrusts. If you're behind a patient and this patient happens to be somebody a little obese, or it's a pregnant woman that's into her late time of her pregnancy, you do not want to do the maneuver in this abdomen area. You're going to do the same thing with your hand. You're going to reach around and you're going to make the thrust around the breastplate. So this is forceful. You've determined the individual needs assistance. So don't hesitate. These things happen often in restaurants. So we're going to have a video that's going to demonstrate this as well.
Hi, my name is Suzanne Mortel, life support instructor for Marshfield Clinic.
Can you guys hear?
Choking is a life-threatening situation that can happen when a person's airway suddenly becomes blocked and they cannot breathe normally. Choking can happen when people eat or drink too quickly or place foreign objects in their mouths. The risk of choking increases with not chewing food properly, with alcohol intoxication, or with an abnormal swallow reflex. Determine if the person is choking. Knowing how to help somebody in a choking emergency can save a life. There are 3 techniques that you should know during a choking emergency. For adults and children, you should use abdominal thrusts, and for infants, back blows and chest thrusts. If the choking person can cough, you want to encourage that person to keep coughing. However, if the person is unable to breathe, cough, speak, or cry, you're going to want to act immediately. Tell someone to call 911 and then let them know that you are going to be helping them relieve the obstruction. If an adult or child older than 1 year is choking, perform abdominal thrusts, also known as the Heimlich maneuver. First, stand or kneel behind the person who is choking. With one hand, make a fist and place it above the belly button. The second hand, lay over the fist. You're going to do quick upward thrusts to try to remove the object. Continue to provide abdominal thrusts or chest thrusts until the object has been removed or until the choking person can no longer stand. At that point, assist that person to the floor and provide CPR by pushing hard and fast on the chest until help arrives. If a child younger than 1 year is choking, alternate back blows and chest thrusts. Position the infant over your forearm and deliver 5 back blows between the infant's shoulder blades. Roll the infant onto your other forearm, supporting his head and neck, and give 5 chest thrusts. Continue to provide back blows and chest thrusts until the infant stops choking or is not breathing. If the infant is not breathing, lay the infant on a hard surface and start CPR by pushing hard and fast on the infant's chest until help arrives. You can perform abdominal thrusts on yourself if no one is around. If you are home alone and begin choking, you can perform abdominal thrusts on yourself. First, dial 911 even if you can't speak. Then, place your fist in your hand above your belly button, find a hard surface such as a countertop or the back of a chair, and give yourself abdominal thrusts. Hi, my name is Suzanne Mortel.
It's not going away. Hold on.
Okay, guys, so that video demonstrated how if you needed to self-administer a Heimlich maneuver, but it also talked about the difference between getting an airway obstruction from an adult and a child. Remember, just because it says 1 year old, there's some kids that are 2 years old that are really tiny. So if the situation is that, and you can lift that child, you know, in your hands and stuff, just because that child happens to be 2 years old doesn't mean you will do the Heimlich maneuver on them. It may be more appropriate that you do the chest blow, the chest back blows. So, and the inverse is the same. And then a kid that is not quite 1 year old, but this kid looks like he's 2. So you have to gauge that. But these are really simple techniques where you can dislodge an obstructed airway by a foreign object. Okay, so we talked about the A of how we treat these 3 killers. Now we're going to talk about the B, the bleeding. There's 3 basic types of bleeding: arterial, venous, and capillary. So arterial bleeding. Arterial bleeding is when the heart is constricting. It's actually under pressure. It's oxygenated. You're going to see it bright red, and it's coming under pressure, so it's spurting out. This is a serious situation because this is the most difficult to control when encountering this type of bleeding. Now, venous bleeding, it's under low pressure. So the heart constricts, that's high pressure. When it's not constricting, this is the venous blood. It's going to be darker in color, bluish kind of, and it's going to be steady flowing. It can be profuse, not as serious as arterial, but can be serious. Now, the third type of bleeding is a capillary bleeding. Capillaries also carry blood, but they're under low pressure. This type of bleeding, you will see like somebody who scrapes their elbow or their knees. If your kids are running and they fell on some asphalt, this is very similar to that. So it's very small. They're going to be oozing because of their low pressure and the size of the vessels. So we're going to play a video, and I just want you guys to look at it, and then I'm going to ask you to see what kind of bleeding is it. To go to 105.
Something terrible.
Okay,
The core.
that I'm adjusting it.
No, 105.
140.
140, sorry. All right, sorry guys, there's a lot of the video that we don't need to see. But
We're going to show you the replay of what happened, but we do want to say it is very graphic, so if you do not want to see it, or anybody watching the game with you don't want them to see it, we advise you. This is not a pretty sight, but we are going to show it to you, what happened to Richard Zednick of the Panthers here in Buffalo.
There it is right there. He goes down, and there you can see where. Well, Clint Malarchuk once told me Jim Pizzatelli saved his life. That was a similar incident where the goaltender, Malarchuk, was not able to skate away from the goal. This time Zednick, as I said, did not look panicked. He did the right thing. He went right back to the bench. And everybody here is standing, and anybody old enough can remember the Clint Malarchuk incident.
Midway through the third period here in Buffalo, we will obviously get your report when we get it on the Panthers forward, Richard Zednick. 4-3 game.
So from what we covered, guys, what kind of bleeding would you think that is? Arterial, venous, or capillary? So it's arterial. So as you saw, that blood came out spurting. It came out under pressure. It was bright red. It's a real world situation. It did occur. It cut his carotid artery, which is one of the main vessels going to the brain. Because there's a doctor there, and they were able to treat him. He's alive today. But yeah, that's an example of a arterial bleed. Under pressure, bright red. Even before he hit the eyes, there was blood there. Serious situation. What do we do when we encounter a situation? So what we're going to do is we're going to try to use a sterile dressing. Sterile dressing is like a pad, as you can see there, where it says 4x4 dressing. And we're going to apply direct pressure. Hopefully, if you have gloves, it may be a situation, especially if If it happens in an unexpected area, it may just be your hands. But we're going to first do is apply direct pressure. Then we're going to incorporate elevation. If direct pressure doesn't stop the bleed, then we're going to do direct pressure and elevate. As you can see, these two pictures there, they're elevating the hand, and that's going to prevent as much blood coming out. And they say that on average, direct pressure and elevation will stop about 90%, 95% of bleeding situations. If that doesn't alleviate the bleeding, we have pressure points. So there's pressure points, and the main ones, as you can see here, there's a brachial pressure point in the back of your arm and here near the elbow, femoral, which is a major artery that goes to the lower legs. It's around the groin area. And on the back of your knee, we have a popliteal pressure point. Now, we had direct pressure. We incorporated elevation. That didn't help. We used pressure points. There can still be a situation where a either severed or partially severed limb that is still not being controlled. So what do? We can apply a tourniquet. When you do apply a tourniquet, this is the last case resort, a matter of life or limb. Everything you've done and tried to do has not alleviated the bleed. Things to remember when we apply a tourniquet. Once it's applied, it cannot be removed. When we do apply it, we're going to denote the date and time, because it may be an individual that is going to have a delayed response by either emergency responders, or if that individual is being driven to a medical hospital. We want to make sure that doctors want to know what time it was done, or if it was a really disastrous situation, a big earthquake, which may be their hours or possibly days, when that tourniquet was applied. When we apply the tourniquet, we're not applying it directly over the wound site or over any joints, the elbow, the knees, ankles. We're going to apply it as close to the injury site as possible when we do apply them. So the tourniquet is going to hurt. Example of one of what they call the cat tourniquets. You can buy them online. They're great. It's going to hurt. You're going to apply it, and the purpose of applying it is to halt the bleeding, because everything you did not alleviate the situation. The things we want to make sure we do not do: we cannot use rope. Remember, we're talking about situations you're out camping, and you're going to need to improvise. Well, what can we do? We can use a T-shirt. I have a member of my unit that a couple of years ago, you guys maybe remember, there was a mass shooting situation in Las Vegas. There was a country concert attended by thousands. It just so happens that a lot of those attendees are first responders, a lot of police officers, paramedics, firefighters. We had a lot of people in our department actually attend it. A lot of people were hurt, seriously hurt. And because of the quick thinking, tore T-shirts, used tablecloths, and they made makeshift tourniquets that a lot of people today are alive or did not lose a limb because of the quick thinking of the people that were there. This is a quick little video that's going to show you for the actual tourniquets that you can purchase online.
Welcome to the CAT Tourniquet video tutorial, buddy aid application to lower extremity. Apply inguinal pressure to the femoral artery. Apply tourniquet proximal to the bleeding site. Route the band around the limb and pass the red tip through the inside slit of the buckle. Pull the band tight. Pass the red tip through the outside slit of the buckle. The friction buckle will lock in place. Pull the band very tight and securely fasten the band back on itself. When the band is pulled tight, no more than 3 fingers will fit between the band and the limb. Twist the rod until bright red bleeding has stopped and the distal pulse is eliminated. Place the rod inside the clip, locking it in place. Check for bleeding in absence of distal pulse. If bleeding is not controlled, consider additional tightening of the tourniquet or the use of a second tourniquet, side by side and proximal to the first, to eliminate the distal pulse. Secure the rod inside the clip with the strap. Prepare the patient for transport and reassess. Record the time of application. For more information about the CAT tourniquet or any NAR products, please visit www.narescue.com or call 888-689.
An example, everybody was able to hear, right? Okay, an example of using a commercial grade combat tourniquet. Situation arises, like I just mentioned, when you have to improvise. You want to make sure we're not using any rope, string, or wire. It can actually cut into the muscle and cause more damage. It won't work. You can use neckties, scarves, torn up t-shirt, tablecloth, even a flag. And you're going to have to improvise it because you're going to be in a situation where you might not have access to this. So here's another video that's going to cover how you can yourself improvise your own tourniquet.
Hey, I'm Luke Williams, and today I'm going to be showing you how to create a makeshift tourniquet. Now, this is not to be a replacement for a commercial tourniquet. In fact, a little piece of advice, jump online and grab one of these. You can get them from many retail stores like North American Rescue, and then keep it in your car or your EDC bag at all times. Now, all that being said, if God forbid you do come up on an accident or have an accident and you need a tourniquet and you do not have a commercial one, we're going to show you how to create a makeshift one. For this, you're going to need 3 things: some type of material, a windlass, and a securing mechanism. Now, the first thing you're going to need is some material. Whether it's an old shirt laying around, or if you don't mind losing the shirt off your back, you can cut it into a long strip about 1.5 inches wide. You never want to use anything less than that, because at that point you could create nerve damage, which is going to cause way more harm than good. Some other things you don't want to use are cables, ropes, or zip ties. Some things you can use that are great ideas that may be laying around are neckties or scarves. You want to stay away from belts, and even though it's better than nothing, you're likely not going to be able to get the belt tight enough to stop the bleeding. Next is the windlass. This is the object that helps tighten the material around the limb that you're working on. You want something that's not going to break with pressure, so I'd stay away from items like pens and pencils. Instead, I'd recommend using something like a carabiner, a solid stick, or even a closed pocket knife. And last is your securing mechanism. This is basically to keep your windlass from unwinding. Some of the more common things you'll find laying around are the piece that is below the cap on a soda bottle, a key ring, or even hair ties will work. If you have another piece of string or material, you can simply tie your securing mechanism to your limb and lock in the windlass. All right, guys, as I mentioned, this should never be a replacement for a commercial tourniquet. And in fact, when someone arrives on scene with a commercial tourniquet, you want to replace this one as quick as you can. Now, I want to know, who carries a tourniquet with you all the time, and have you ever had to use it? If so, let us know in the comments below, and then make sure you head to Raider Red's YouTube channel.
Okay, he did talk about the preference for a commercial grade. Yes, that is preferred, but if you applied any kind of tourniquet, you don't want to be the one to remove it. That has to be done in the hospital setting under the supervision of a doctor. Very serious. That's why it's really important to remember when we apply it, denote the time and date. And if you're going to apply a commercial one, and if there's a makeshift one, apply it next to it. Don't remove the other one. Keep it. Don't replace it. Okay, so pulse points, really similar to pressure points. We have different pulse points where you can put your fingers and you can gauge the pulse. Why is this important? If we're applying a tourniquet, we want to make sure that we stop the bleed. It could be obvious that you stop most of the bleeding, but you're going to want to take distal pulses. Distal pulses, for example, as you can see there, there's radial. You can take your pulse on your wrist, on the thumb side of your wrist, with 2 fingers. Don't use your thumb. Your thumb because sometimes you will be feeling your own pulse. 2 fingers, if you want to use 3, you can. You want to make sure that you're no longer feeling pulses once you applied a tourniquet. In most cases, it's going to be either the radial pulse or the 2 lower pulses, the posterior tibial and the dorsalis pedis, which are on the foot. Now, another way we can gauge whether we were able to effectively apply a tourniquet, it's what's called capillary refill. So capillary refill, and this also applies to when you want to gauge somebody who may be going into shock. It's going to gauge perfusion within your body. If you take one finger, I like to use the thumb because it's pretty obvious, it's a bigger fingernail, and you press it down 5 to 10 seconds, it's going to turn white. When you release it, it should get back to its normal color in 2 seconds or less. If it doesn't necessarily mean that, well, there's a situation happening. If you're in an environment in the cold, you're out at Mammoth during snow, it could be the ambient temperature. Or you can have an elderly person or an individual that has some kind of a medical condition. But if your person is relatively healthy and you do the capillary refill, it should take 2 seconds or less. If you don't, what is 2 seconds? By the time it takes for you to say capillary refill, it's approximately 2 seconds. So a little good way to remember that. Okay, so we covered the A, the airway. We covered the B, the bleeding. Now, shock. What is shock? It's a pretty serious situation where there is a sudden interruption of the blood flowing through the body and circulation throughout the body becomes ineffective. In essence, there's not enough blood flowing properly throughout the body. What can cause it? It could be what they call cardiogenic shock. There's a situation with your heart. Hypovolemic shock, there's not enough blood circulating through your body, maybe because of blood loss externally or internally. Anaphylactic shock is caused by some kind of an allergic reaction. Many people are allergic to peanuts or shellfish. And if they go into shock, this is what is anaphylactic shock. Septic shock is shock due to some kind of an infection. And neurogenic shock is damage to the nervous system. Okay, again, another simple way to remember this. How do we recognize this? RPM. Respirations, perfusion, mental status. If you're looking at somebody that has rapid, shallow breathing, you're going to check perfusion. You're going to check the pulses, either the distal pulses on the radial or the 2 pulse points on your feet, or you can incorporate the capillary refill. Remember, there's some people that have nail polish. If you can remove that nail polish, great. But if you don't, guess what? Press your thumb. Same thing. Press the end of your thumb, keep it down, and release it. It should return to its normal color within 2 seconds or less. And you want to gauge this individual's mental status. You're going to ask them something simple. You're not going to ask them, hey, who won the Super Bowl last year? Maybe he knows or maybe she knows, but you know what? Hey, squeeze my hands. Something simple like that. You want to make sure that they can follow simple commands. Other signs and symptoms can include cold, clammy skin, a pale, ashen look to the face, a grayish appearance on the lips. They're going to have an increased respiratory rate. They may be feeling nauseous or may be feeling like they want to vomit. They're going to have or demonstrate possibly enlarged pupils. They're going to appear weak and fatigued, and they may even be a bit anxious. So what do we do if we encounter a situation when somebody is manifesting signs of shock? We're going to lay the victim down on the ground. We're going to try to elevate their feet anywhere between 6 and 12 inches, depending on the age of the victim. Why are we elevating the feet? The body is an incredible piece of God's work. The body will go into defense mechanism. It's going to draw blood out from the largest organ of your body, which is your skin. So it's going to go into the vital organs, your heart, your lungs, and your brain. We're going to make sure we have patent airway. Remember, we talked about head tilt chin lift method or the jaw thrust method if we're suspecting some kind of a head or neck injury. And if we do see or witness any kind of bleeding, we're going to make sure we're controlling it. We're going to maintain the core temperature because as the blood is flowing away from the skin and going into the vital organs, we want to maintain that individual warm. If we witness an individual possibly starting to, or you see blood coming from the mouth or vomiting, we're going to place them on what we call the recovery position. The recovery position is placing an individual on their left side. They may ask you for water, that they're thirsty. They may be hungry. Refrain from giving them anything to eat or drink. If you do, the individual may aspirate that water or that food. So another quick video about treating and how to treat an individual going into shock.
Hi, Captain Wayne Bennett here with another quick first aid tip from our One and Done series, teaching you how to save lives in 1 minute. Today's first aid skill is how to treat shock. Since shock is one of the 3 things that you can die from, immediate treatment must be given. So call 911 immediately, get the paramedics on the way. So now what? We've called 911. Most folks are unsure and confused about what to do in the case of shock. So we're going to give you some quick, simple tips that can make a huge difference in your patient's survival. So what is shock and what can we do about it? Shock is a blood flow problem. Quite simply put, a lack of blood flow to the brain. This can be dangerous because brain cells can only live 4 to 6 minutes without oxygen. So the body immediately goes into survival mode. In order for the body to survive, the body has to get more blood to the vital organs. So it begins compensating by taking blood from one organ and giving it to another. It starts by taking blood from the largest organ on the body, the skin. Now that's the good news because the skin cells can live hours without blood flow. But that's also why your patient's going to get cold and pale. The early signs of shock can be anxiety, feeling restless, apprehensive. Then the skin goes cool, pale, clammy, your heart rate increases, breathing becomes rapid, but it becomes very serious when the victim becomes unconscious or unresponsive. Your job is to interrupt or delay the shutdown process by simply placing the victim in the shock position, which is lying the victim down and elevating their feet 6 inches for a child and 12 inches for the adults. This will allow blood from the legs to flow back into the core where all the vital organs are. But your work doesn't stop there. Remember how cold the skin was? Well, we have to cover them up quickly with a blanket. Blood will be sent away from the vital organs and back out to warm up the skin. So use a thermal blanket. It's a bright and shiny surface. It reflects 90% of the victim's heat right back to them. This 6x7 foil blanket will keep the victim nice and toasty, driving blood flow back into the core where it's needed. And one last tip, never leave an unconscious shock victim alone on their back. You must put them in the recovery position on their left side. Of course, that's a great idea for another video. Thanks for watching and please subscribe below.
Okay, guys, as you witnessed in that video and the previous videos, these techniques aren't very complicated. They don't involve you having a mass of equipment. If you happen to have it, it's great, but you may be in a situation where you don't have access to that. So these simple techniques, you know, recognizing when an individual is going into a state of shock, the techniques that you incorporate, placing that victim on their back, making sure that we have, remember the ABCs, that we have a patent and open airway. If we don't, a couple of techniques that you can incorporate to make sure that that airway isn't being obstructed because of the tongue. If it is a foreign object, we can address that. Remember, we talked about the Heimlich maneuver. And if the individual is under a year, we could do the back blows. We also talked about if we encounter a situation where there's bleeding and it's uncontrolled, what can we do? Recognize what type of bleeding it is. It's an arterial coming out bright red under pressure. Remember, under pressure, the heart is constricting. It's pushing it through the body. It could be a venous bleed when it's not under pressure. It is still coming out. It can be serious, but you can recognize it because it's not spurting out and it's not bright red. Or the least serious one would be a capillary one. What do? Direct pressure, elevation and direct pressure points. The last case scenario, we can incorporate a tourniquet. If you happen to have one of the commercial grade combat tourniquets, great. If you don't, we can manifest our own. We don't want to use rope. We don't want to use string, zip ties, like what was demonstrated in the video. That can cause more damage. If we do apply it, what do? Just remember, when we apply it, we're going to apply it as close to the wound site as we possibly can. We're going to make sure we don't apply it over any joints, knee, wrist, the elbows. We want to make sure when we apply it that we denote the time and the date that was applied. Once we apply it, we do not remove it. We're going to check for distal pulses or capillary refill to make sure it's effective, besides being visually seen that it's stopping the bleed. If that doesn't help, maybe the additional tourniquet that's applied right above the first one. And remember, if, for example, I have a partially severed hand here, and I'm going to need to apply tourniquet, I don't want to apply it way over here. I want to get as close to the wound site as I can. It serves two purposes. It's closer to the wound site. It's going to apply direct pressure where that blood is flowing out. But guess what? God forbid that individual's hand, they're not going to be able to save it, or they're not going to be able to attach it surgically. If you put the tourniquet, guess what? It's not just that portion of the hand he's going to lose. It's going to be from the placement of the tourniquet down. We want to get as close to the point of the injury site as we can. However, we don't want to put it over any joints and directly over the wound site. We talked about shock and looking at it. So simple techniques, guys, that we covered that you can save a life. You can save an individual that is going into some kind of a situation. And you don't need to be a doctor, a nurse, paramedic. It's great if you decide on your own to take an EMT class. That'd be amazing. But even if that is something that you don't do, these simple techniques that you've learned today, you can use and incorporate them in a situation where you can make the difference between somebody being able to go to the hospital and be sent home eventually, just by taking simple steps and simple interventions. So hopefully the material that we covered, it made sense. What we're going to do is we're going to open it up to any kind of questions. And before we close today's session, Kimberly is going to also cover a couple of things for you. And then for those that stay, we do have, we have 3 trauma shears, and we have 1 combat tourniquet, so that we can do a raffle like we did the last class, and be able to give those to you. So we can take this off, right? So does anybody have any questions regarding any of the material that we covered, or anything that maybe wasn't covered that you might want some clarification?
So I was sent a few questions. The first one is, why would a tourniquet be a last resort device? How long on average can a limb last before they lose the limb?
Okay, very good question. So the reason why the tourniquet is your last case resort is because you tried direct pressure. You tried direct pressure in combination with elevation. If that didn't stop the bleed, then you did that along with a pressure point. So guess what? You're in the grocery store and you're the only one that knows how to do this. You see a young man here. Hey, I need you to hold this hand up of this patient here and apply direct pressure. That leaves you, the individual that actually knows what you're doing, the ability to do something else. Hey, sir, come here. I need you to apply pressure. This is the pressure point. If that doesn't alleviate the situation, it's a serious bleed. That person can go into shock and eventually death if we don't stop the bleed. So the only other course of action would be the tourniquet. So in the event that there is some kind of severed finger, hand, or some other part of the body in the legs, what you want to do if there is, for example, a severed portion of the hand, you want to place that, if you can, in a plastic bag. If you have access to ice, maybe in a bucket, put the ice in a bucket and place a few towels. You don't want to place that portion of the severed body directly in contact with ice, but you want to keep it cool. It's been demonstrated, and I don't know an exact time, but a couple of hours, that surgeons were able to reattach certain limbs to the body. And I think it's a couple of hours. I'm not sure if it's 2 or 3. I think there's a lot of different variables. One, how soon that individual was taken to the emergency care hospital in the setting that where a surgeon was able to start that process. It also depends on what time of the year it is. If it's out in a cold setting near the snow, that factors in the individual's health and age. So there's a few different factors that will determine how long and viable the surgeon will be able to reattach that limb.
So the next question is, when replacing a makeshift tourniquet with a commercial one, would you apply the commercial one above or below the makeshift one?
It really depends where they do that. So it's like really good thing to remember, good rule of thumb is place, whether it's a commercial or a makeshift tourniquet, as close to the wound site as possible. So for example, Pia has a partially severed hand here. I'm going to try to place the tourniquet, if it's a makeshift one, right here. And if it's not helping, or now I have access to a commercial grade one, I'm going to apply it directly above it. It really depends how close to the wound site you applied the makeshift one. But even that makeshift one, we're not going to remove that. We're going to apply the secondary one, whether it's another makeshift one or a commercial grade one, and keep both of them. But you want to make sure that you got the time where the first one was applied, whether it was makeshift or commercial. And then if the second one was applied 30 minutes, an hour later, it's important when that patient gets taken to the hospital, that the doctor's going to want to know how long those tourniquets, both of them, have been in place.
Okay, so the next question is regarding shock. Why put them on the left side? Is the right side okay as well?
Okay, so the reason you place them in the left side is what they call left lateral. The way the body's constructed, there is less of a chance for that individual to aspirate. In other words, whether they're bleeding through the mouth or they're going to start to vomit. If any of that goes into the windpipe and it goes into your airway, it could be pretty serious. So by placing them in the left side, the way the body is, the physical characteristics are, it's less likely from the left side than placing them on the right side for them to aspirate, whether it's blood or vomitus.
Why can't you use rope or tie? What kind of damage will it cause?
Okay, so good question. When you have something like a rope, the diameter is much smaller. So what you're trying to do is get a wider surface area. So for example, let's just pretend this is a necktie. We're going to try to get something anywhere from 2 to 4 inches if we can. Sometimes we may not have that, but placing this tightly over it, as opposed to this, which should be rope, could be wire, could be zip ties, it's going to cause major vessel nerve damage, and it's not going to completely be effective. You're covering a much wider surface area when you're using, for example, a necktie, or you cut up a t-shirt. So it will cause it'll cause a vessel damage and nerve damage by using something like a rope or a wire. So we want to stay away from those. Again, we could use a t-shirt, use pants, you could use socks.
I think that's where those scissors come in handy.
Yeah, so these trauma shears, in the emergency care setting, they're great. You can cut, we've cut people like for motorcycle drivers. I was stationed up here in Station 82 in La Cañada, right near the Angeles Crest Highway. A lot of motorcycle drivers, especially over the weekends. And guess what? They're wearing these super expensive leather suits. And they came into a collision with a vehicle or something. We're going to need to cut that stuff off. We can cut leather boots off with these. So we can cut shirts, makeshift tourniquets that we can make. So these are really good pieces of medical equipment to have in your go bag, or if you have them in your vehicle, it's a good idea to think about incorporating them. Or even, for example, this commercial grade tourniquet. In the front of it, you could denote the time and the date here with a marker or a pen. These are great. They sell them on Amazon. You can spend a lot of money, or
they're being given away free today. So stick around. I know we're over 11:30 and we apologize. We started late, but if you stick around to the end, you could have these.
Yeah, so any other questions, Kimberly?
Yes, there's 3 more. If someone has a wound on their chest, how do you keep it elevated?
It's a good question. There are some wounds that are a lot more involved. Any kind of wound in the head, for example, somebody gets struck by an item in the head, or even in the face, that can be a lot of profuse, a venous type of blood flow, difficult to control. In the case of the chest, it would be the matter of doing some kind of, and again, we're also taking into account that there's no suspected neck, head, or spine injury. If it is a chest wound, maybe you could slightly elevate the person, propping up some pillows or in the chair. In that case, it's going to be a little bit more involved. Obviously, the limbs, the arms, and the legs, you can manipulate much differently. The inner torso and abdominal wounds are also very tricky, and you're gonna apply the same techniques. You're gonna apply direct pressure, and in this case, you're not going to be able to elevate, but you're going to monitor the patient. Another thing that you can't put too much of importance on, but that makes a big difference, is being there for that patient, reassuring them. You may be a stranger to them. Hey, my name is Albert. I'm here to help you. You just saying that, or it's a child, and kneeling down to the level of that child makes a huge difference. Being able to talk to them. They're already anxious. They're already feeling panicky. Just a simple thing as that, asking them their name, introducing yourself. You see them wearing a Dodger t-shirt. Hey, taking them away from that moment makes a world of a difference.
So the next question is, many infants are too big to simply hold over one arm. Does that mean back thrusts are better if they are choking?
Yeah, it's all going to depend. It also may not be the infant. You yourself might be kind of small, and you may not be able to do that. So if that's the case, and there's people around you, and maybe they don't know, direct them to do that. But just remember, you want to get 911 rolling right away. Don't hesitate. Even if you think it's not serious, but you're not sure, call right away. Don't hesitate to get 911 rolling. Now, if that infant is bigger, some kids might not even be a year old, and you look at them, they look like they're a year and a half or 2 years old. So that age is just only a gauge. So if it's a particular kid that is really big for their age, you may actually be able to do the Heimlich maneuver.
And then the last question is how to respond in the case of allergic shocks due to food, like seafood. Is it the same way that we watched in the video?
Yeah. Now, when it comes to anaphylactic shock, like eating seafood or nuts, one of the first things that happens is swelling of the airway. So it's crucial that right away you maintain that airway open, especially if that individual becomes unconscious, then it becomes even a little more serious, because while they're conscious, you can monitor them, you can talk to them, refrain from giving them anything to drink. They may be really thirsty, but you don't want to do that, because if they become unconscious, then there's an increased possibility of them aspirating vomit or some of the regurgitative effects that sometimes the body will start to manifest, and they could regurgitate that, and it can go into the airways and into the lungs, and that becomes a much more serious matter. So yeah, we would incorporate the same techniques for any kind of allergic reaction with all the other types of shocks that might manifest.
So if you have any other questions, Albert does need to go to work, but I think you have a few more minutes. You can stay behind. We just don't want to keep everybody. So I know we were supposed to do some demos as well, but I think we ran out of time. So I think we should just get to the raffle, Kimberly. So I'll let you have that part.
So let's go ahead and raffle off the 3 shears. So the first one is going to Boone.
Yay, Boone.
Yay.
You can drop it up at your house since you're our neighbor. So you can come.
Don't worry, we'll come. Thank you.
Okay, congratulations.
The second pair is going to Terry Chang.
Terry, congratulations. This is yours. Okay, now the big one is the tourniquet.
Well, we got one more.
Oh, we have
one more.
One more shear.
And then the last pair is going to Valerie.
Congratulations,
Yeah,
Valerie. I guess she left, huh? But
yeah.
Okay, this is the tourniquet.
The tourniquet is going to Georgina.
Georgina.
All right.
Woo!
Yay, thank you.
All right, we'll make sure, just email Mary Roberts if you know her email. She's the one who sent out the reminders.
Okay.
And we'll make sure we'll get these to you. Is there anything else, Kimberly, Dennis? I think we.
Yeah, well, Kimberly didn't get an opportunity to introduce herself. Maybe before we close.
Yeah, go ahead.
We can give her the opportunity.
So my name is Kimberly Morales. I am connected through to Acts of Mercy through the Myanmar team. So I will be launching this August to Myanmar, and I will be helping the team out with figuring out what the most important needs are before we have teams come over. So I'll be working with human trafficking, education, medical, businesses. And so my first few months there will be mainly focused on meeting up with churches and all the nonprofits and just seeing what's needed in terms of what's happening with COVID and what's happening with the military coup.
Wow, that's a lot.
Yeah.
We're very proud of you, Kimberly.
Thanks.
And yeah, so we don't want to keep you guys anymore unless you have questions. Dennis, did you want to say any last minute words?
Nope, I'm good. I'm just glad all you got to come on. I think it was Albert, you did a great job, and it was really good information to give to us. Very, very crucial information. Very nice job.
You worked hard on it.
It was really nice. I really like the presentation too, like the talking, and then the videos helped as well. So it's very helpful. Thank you.
Yeah, if any of you have any questions, even if they arise in a day or two, you can personally contact me. And even if it was stuff that wasn't covered here. The next class is going to incorporate some other stuff. And I hope that you'll be able to attend that next class 4. And we can expound on some other things that you will be able to make a difference in somebody experiencing possibly one of the worst situations in their life.
Yeah, it's the last Saturday of April. So you can mark your calendars and make sure you register through the Epicenter website. So, all right. We appreciate you all coming. Have a great rest of your day. God bless you guys.
God bless.